All right, ladies and gentlemen, welcome to another episode of James's Corner. I am your host, James Richardson, and today I have a very special guest on, Natalie Brown. She's a stage 4 lung cancer survivor and advocate, also a recipient of a double lung transplant. I'm very interested to get in to know her story, get to know her as a person as well. Natalie, thank you for joining us today.
Sure, James. Thanks for having me. I'm excited.
Yeah, of course. Me too. I appreciate you coming on. Natalie, let's just start at the beginning. Introduce yourself to the audience, who you are, why you're here. We'll just start with that.
Yeah, so my name is Natalie Brown. I am originally from Atlanta, Georgia, currently residing in Chicago, Illinois for the moment. I'm here because I want to share my story. I am all about advocacy and trying to help educate for this terrible disease. I was diagnosed with, unfortunately, stage 4 lung cancer in 2020, and I was originally told that there was no cure for me or I would never go into remission. And then probably about 8 months or so ago, my pulmonologist basically came to my door with a miracle saying, "Hey, I want to present you to some people that I know to refer you to possibly get a bilateral lung transplant." And this bilateral lung transplant actually saved my life because I was going to die without it.
Wow. Well, I'm glad that they were able to give you that information. Um,
Yeah, same.
yeah, Natalie, I want to start because you gave a little bit of information. I want to start at the beginning. You said you wanted to advocate for the illness. How come you wanted to start advocating? We'll obviously get into the process of what you went through, but I want to know like your mentality of why you wanted to give back and advocate for the illness.
Of course. So lung cancer, as most people know, is associated with smoking. That is, unfortunately, the stigma that is associated with it. So I want to basically advocate to let people know that this is not just a smoker's disease. Anybody can get lung cancer. And I mean, to be honest, I can't really blame people because prior to me being diagnosed, I thought the same thing. So I want to let people know, like, hey, number one, this is not just a smoker's disease. Anybody can get it.
Mhm.
Number two, stage 4 does not always mean death. I
Mhm.
thought the same thing also.
Mhm.
But there are a lot of opportunities and treatments to further extend people's lives than what we know about or knew about back then.
I see. Okay, that makes sense. And
Yeah.
how did when they diagnosed you with this cancer, can you just walk us through the process of how that happened? What led up to that process and kind of how that was for you as a human being just to process all of that stress?
Yeah, so it took me about 6 or 7 months to officially get diagnosed. I was doing 2-a-day workouts, so I kind of associated my fatigue and being tired with that. That's not what it was. It was related to cancer. And then I also had a chronic cough for months, just like a general cough. I feel like everybody coughs. So I kind of thought it was nothing. I also had asthma, so I thought it was related to my asthma, but I first started feeling these symptoms. I went to the urgent care and I was told, you're having bronchiospasms. Like you're good, gave me an inhaler, and went home. And I'm like, okay, fine. After a while, it never really went away. So I decided to go to the doctor, just a primary care doctor. Went to the primary care doctor, and the primary care doctor says, "Oh, it's probably just your allergies." Oh, I forgot I got allergies too. So I got everything. So he said I have allergies, and I'm like, okay. So I took, the normal allergy medications, tried that for a while. That didn't work. So I
Mhm.
went back to the doctor, and I'm like, hey, we got to figure something out because we keep coming up with all this stuff and it's just not working.
Mhm.
So she said, okay, I'm gonna be honest with you. I'm not really sure what the deal is. Let's refer you to a pulmonologist. So I'm like, okay, great. Went to a pulmonologist. She was really good. The first thing they wanted to do was an x-ray of my chest, and they wanted to give me a breathing test. So we did the x-ray and then we did the breathing test. So, I mean, probably within like a 5 to 10 minute span, they came back after they got the results and, they were looking at me weird. And I'm like, why are you looking at me like this? And they said, well, have you traveled outside of the country lately? And I was like, well, not lately. And then they asked me, have you ever been diagnosed with tuberculosis or malaria? And I'm like, okay, what's going on? Because
Mhm.
nobody's ever asked me
Yeah,
about these weird diseases
right.
before. And they said, well, you have like these weird spots on both of your lungs. And I'm like, oh, okay. Well, I'm thinking once again, it's just nothing. So she's like, okay, well, we need to do some further digging, some more tests. So they put me through a ton of tests. Eventually, of course, I had to get a biopsy to try to figure this whole situation
Mhm.
out. Um, got the biopsy and was actually called and told that I didn't have cancer. They called me and
You did
said,
not have cancer.
yeah, they called me and said, well, the good news is you don't have cancer. And I'm like, yes. Okay, so let's figure out what I actually have.
Right.
So of course, in that moment, I'm like, anything else I can deal with as long as you're telling me that it's not cancer. So we went through the whole process. Unfortunately, I developed pneumothorax, which is your lung collapsing. And basically, I noticed that because I had a tightness of my chest and I couldn't breathe well.
Mm.
So I ended up having to go to the hospital, and they actually repaired my lungs and wanted to do another biopsy. So I said, okay, fine. So they went in there, they got more tissue or whatever it is they needed. I woke up and my husband was on the right side of me. And then the doctor was basically like standing there. My husband looked like his eyes were watery or something. And I'm like, what's wrong with you? Like, I just got done with this biopsy. I'm ready to go home. I thought I was feeling pretty good. Well, that is when my whole life changed. So I said, is there something that you guys need to tell me? Because of course they're just looking at each other crazy.
Mhm.
And the doctor says, well, your biopsy came back. Of course, we need to send it to pathology, but from what we can see, you have cancer. And I was like, wait, no, I don't. I said, because you all called me and told me that I don't have cancer. So how is it that I have cancer now?
Yeah.
And so my husband was like, Natalie, it is cancer. So they never gave me a stage. They never actually told me what kind of cancer because they were not sure. They just said that they saw some things in my lungs. So they said immediately, we're going to refer you to an oncologist. And that's when the whole story changes again.
Okay, before we get to that, I just want to unpack a
Yeah.
little bit about what you just said because
Yeah.
there's a lot there. But I want to continue because this is very interesting. Um, how how is it possible for them to take a biopsy, tell you that you don't have cancer, and then take another biopsy and say that you do have cancer? How is that possible? Did you ever ask that question?
I did. They literally said that the tissues that they tested just were not coming back positive for any type of like cancers. And it just never really made sense to me.
Yeah. And
Yeah.
after you've analyzed this, I'm sure for as long as the time as it's been, what is your analyzation of this process? Do you think that it's like that it was like in your best interest, or do you think it was just kind of like, well, whatever, you have cancer?
Um, I've got mixed feelings on it because
Yeah.
immediately after the process, I went and got a second and a third opinion.
Hmm.
So after I got those second and third opinions, I'm like, okay, they immediately said I had cancer. There wasn't a
Oh,
question or hesitation about it. So it kind of led me to questioning my original medical team.
yeah, exactly. And did they give any response to that? Did you, or they were
I
just
mean,
not like they
they
cared?
were apologetic,
Oh,
but,
that's nice.
from an emotional standpoint,
Yeah.
it's like it was a complete roller
Yeah,
coaster.
it's they put you through hell in a way.
Yeah, it definitely put me through hell.
Absolutely. Okay, so
Yeah.
that they took the second biopsy. They told you have cancer. They don't know what stage it is or anything like that.
So I think that they knew they may just didn't want to tell me,
Of
or
course
they
they did.
just didn't
Yeah.
want to give me the wrong stage. So they wanted the actual oncologist
Hmm.
to stage me or to tell me the stage rather.
I see. Now, from the
Yeah.
first biopsy to the second biopsy, was the cancer
Mhm.
worse and did it spread?
No, it hadn't. No. Mm-mm. Well, no, I'm telling you no now, but we had to do testing. We had to do
Mhm.
more testing after the oncologist to make sure. But no, to answer your
Okay.
question,
So it just stayed the same. It didn't grow. It didn't get bigger, smaller. It was just the same.
not between that time. No.
What was the duration of time between those two appointments?
Ooh, it probably was about. Maybe maybe a month. It
Okay.
wasn't that long.
Okay, not that long. Okay.
Yeah.
So let's continue. Okay, so now we've gone through that first process. Now we've when they told you this, obviously your husband was there. You said he was on the brink of tears, essentially, right?
Yeah.
Which is
Yeah.
understandable. What was because you said when they told you, you said no immediately, right? Which is probably a normal response for a human being who's just told that they have cancer. What
Right.
was your what were you feeling in that moment when they were like, "Oh, you have cancer"? What was like your initial reaction? I'm sure you were shocked, but what was afterwards? What happened?
So my initial reaction was I wonder what stage it is. I wonder like how did I get it? I wonder why did I get it?
Mm,
Like just
yeah,
all of those immediate questions.
right.
Like he even tried to like take me to my favorite taco spot after we left the doctor and I just couldn't eat.
Yeah, yeah.
So
I'm sure it was
yeah.
very heavy on your mind. Do you
Right.
did they know why? Did they ever tell you why you got cancer? Or they
No, to this day, they have not been able to tell me. It does not run in my family. Of course, they did genetic testing also. They couldn't
uh
find anything. But no, to this day, none of the people that I got opinions from have been able to tell me why, how, or anything. They don't know.
Isn't that crazy?
It's very crazy.
It's just crazy to me that they can tell you have cancer but have no idea where it comes from.
Right. Yeah. Same.
But if you were a smoker, they would say it comes from smoking.
Yeah, they would have pinpointed on smoking automatically
Yeah.
because they have nothing else to pinpoint
Right,
on.
exactly.
So
So
yeah.
essentially they don't know, but they just make something up in a way like, "Oh, it's a smoking."
Yeah,
Yeah, it's
it's
like
probably just what they do generally.
yeah,
Yeah.
exactly. Yeah,
Seriously.
exactly. Yeah. And I have a like, yeah, I'm obviously talking because I've experienced this a lot of my life too. And it's very
I'm
frustrating.
sure.
Medical industry, I get very frustrated with the way that they operate, but that's
Yeah.
true. But okay, so we have the second biopsy. Now you've been diagnosed with cancer, and
hmm
let's go from there. What happens after that?
Yeah, so we get to the oncologist's office. Her and her assistant come in, and they look at my husband and I once again as if we are supposed to know, but she's talking to me as if I already know the stage and like the primary and everything. Keep in mind, I didn't know any of this.
Yeah.
So she says, okay, and she starts talking, and she's like, yep, so you have stage 4 non-small lung. I was like, whoa, whoa, whoa. I said stage 4. I said, I didn't know anything about this. So to jump back for a second, I
Mhm.
did read paperwork before I went to the oncologist's office. And by me reading, and of course having no knowledge of cancer, I was like, oh yeah, it's probably 2, maybe 3. So
Right.
that's what I'm thinking in my mind. However, I didn't know I was going to get hit with 4 when she came through the door. So she
Because
said,
four
you have,
essentially, sorry to interrupt you, Natalie.
yeah, no, you get
Four essentially means there's no coming back, right?
right. Traditionally, it
Traditionally,
can
like when
mean that,
someone says
yeah,
that, that means okay, you're pretty much gonna, for a better term, you're gonna die. Essentially, is what they're telling you, right?
right,
Okay,
pretty
so
much.
so you must have
Yeah.
been in a panic.
Yeah, I was in a panic because like I said, now that I know that I had a stage 4 and there are other options, I immediately thought like, hey, okay, this is pretty much it. So
Uh,
she said you have stage 4 cancer and it's non-small cell and your primary, she's like, we had a hard time figuring out where your cancer originated from, but now we're pretty sure your primary is lung cancer. So you actually do have lung cancer. And then I'm like, what? Again, I mean, even though I saw paperwork that said I probably do, once again, I'm still
yeah.
thinking lung, like where the heck did this come from? So once she's saying all this, I think I experienced some type of like weird, I don't know if you want to call it an inner or outer body experience, but I like passed out sitting up. So like people in the room became blurry. I didn't hear anything and I just started like falling over to the left. And I know my husband was catching me. So I guess I was in the process of like passing out. I don't
Right.
really know.
Right.
But it was very weird. So I asked her, I was like, okay, well, let's start chemo like tomorrow. And she's like, hold on, well, you're a little anxious. And I'm like, well, you just told me I got stage 4 cancer, so we need to get this moving. And she says, well, we have to check to make sure that it has not spread to other parts of your body. So we need to do a PET scan, we need to do an MRI of the brain, we need to do all the other testing to make sure. So of course, this takes like another 3.5 weeks, and I'm freaking out even more because I'm like, oh my gosh, what is it? What if it's in,
Torture.
yeah, what if it's in other parts of my body? And then I also learned about what they call biomarker testing. I didn't know anything about that. So this biomarker testing basically helps to determine if you are a candidate for certain targeted drugs. So in my mind, I was hoping that I was a candidate for it because most of the time when people are on these targeted drugs, in my opinion, sometimes they seem to have better chances. Just my opinion now, that's not
Hmm.
medically written. Well, okay, so I had to do all the testing about 3.5 weeks later. It came back that It had not gone out to any parts of my other body. It was in both of my lungs and it was in all the lymph nodes that were in my lungs, but it was still considered to be stage 4. And then I was told that the biomarker testing that they did, actually, none of my biomarkers came back as anything, which was weird for my age. I was what 33, 34, 5, see, I had to count how old I am. I was 33 at the time, and I was a non-smoker. They said it was very weird that I didn't have any biomarkers. So I didn't qualify for any targeted drugs. So I had to go the traditional route, which was the chemo, or now immunotherapy is considered kind of traditional. I didn't do any of the targeted drugs. So I was kind of sad about that. However, once that was said and done, I started chemotherapy. Oh, sorry, backtrack. That's what I told you earlier. I was told that I would not ever go into remission and I would not go, there would not be a cure also because of where the cancer cells were located, like at the outer part of my lungs, like it was going to be harder to treat them or to get them smaller because of where they were located. But I was told a positive of the situation. I guess you call it a positive. It was not aggressive. So it was very slow growing. So that's the one thing that I had going for me because if it was aggressive,
Mm,
you
I
do the
see.
math on that.
I see. I
Yeah.
see. So they told you that there's no chance of remission, which
Yeah.
essentially means there's no way of getting rid of it. Is that what that is?
hmm
Okay, so
Yep.
there did they give you a time limit that you were going to live to?
No, they actually did not. Nobody did. None of and I hear a lot of people say that their
Uh-huh.
medical providers tell them they never ever said like, hey, you have 5 months. But I will tell
Hmm.
you what they told my husband, which I don't remember this. He said that they told him that the goal is to make me comfortable.
Oh my
But
gosh.
I don't remember them saying that. Of course, I'm going through all the crazy things, so they probably did say it. I just don't know.
It's quite inhuman in a lot of
Yeah.
ways, the way that they operate. Um, okay, so you wanted to get chemotherapy started right away, and did you was that the route you wanted to take, or that's just what you thought that was the right way to take that route?
I just thought it was the right
I
way,
see.
right way. I didn't know anything
Yeah.
else. I didn't even know anything like immunotherapy even existed to help fight, work with your immune system. I didn't know anything about that. So
Mm.
once they said that it hadn't spread elsewhere, that's when the immunotherapy option was presented to me along with chemo. So I actually started off with immunotherapy and 2 chemos at the same time.
And what is
So
immunotherapy? What is that?
basically, it works with your immune system to try and help fight off the cancer.
I see. So
It's
what like
fairly new,
I see. Okay, so what boosts your white blood cells or something?
basically. Yeah,
Okay.
to try to help attack.
Got it. Okay. So you were going through immunotherapy and chemotherapy at the same time.
Yep, at the same time.
Can you walk us through the process of chemotherapy and what that was like?
It was hell. So I was actually still working while I was doing all this. And it was crazy because my job didn't even know I had cancer. I
Wow.
basically fake it till you make it. Yeah, that's
So
what
you
I was
kept it a
on.
secret at
Uh-huh.
your job. Was that difficult for you? Were you like struggling?
Yeah, I was struggling, but I would do, I mean, I was working from home.
Oh,
So it
okay.
was like,
Okay.
put on a little makeup, take a meeting, take a
Right,
nap,
right.
back
I
and
got you.
forth.
Got you.
Yeah.
Got you. Okay.
Yeah, it was rough, but I made it work. So yeah, I started out with these immunotherapy, this chemotherapy, and with immunotherapy, there weren't really many side effects for me, but with the chemo, of course, there was. The number one side effect for me was fatigue. I was so weak. I was so drained. There were times where, like, we have a lot of steps in my house. I couldn't even walk up the steps. I had to have people to make me food, do everything for me. I couldn't do anything. Thankfully, throughout the process, I actually never threw up. I don't really know how, but never really threw up. So, like I said, fatigue was probably my biggest thing. And then I actually had a little bit of pain, but that kind of developed further down the line. The pain was because the cancer was pressing down on some nerves. So it actually made like the left side of my rib cage area hurt. That was later on
Oh,
though. But directly from the chemo, probably the fatigue was probably just the worst for me, I would say. I mean, it's like really, you just don't want to
Yeah.
do anything. And the way that mine works, mine didn't kick in immediately. So if I got chemo on a Monday, it might not kick in till like the fatigue might not kick in till Wednesday. And
Oh,
then
it
it would
takes a couple
last
days.
for me, but it
Uh-huh.
was just me. Other people, it pretty much was instant.
Okay.
But it would last probably for about 4 to 5 days. And then I would slowly start getting back to normal. And then, well, normal.
Mhm.
But I would get back to normal and then I would wait because the chemo and immunotherapy was once every 3 weeks. So I got a little break in between, and then we just once every 3 weeks. I was on chemo for 4.5 years
What?
straight, with the exception of about 10 months.
You're on
So
chemo for 4.5 years?
yeah, with the exception for about 10 months. And that's only because I asked for a break. I was like, hey, can we get a break? I feel like my body needs a break. My scans are stable, which means they
Wow.
have not grown. I need a break. So it's only because I asked for a break.
Is that normal?
I'm learning that it actually is.
Really? So people are on
Yeah.
chemotherapy. So is the why is it taking so long if chemotherapy is working?
I don't know if it was, well, I guess it was working. It kept me stable.
But is it killing the
So
cancer? Is it
no, it's just keeping it stable. It's
okay?
basically not growing, but it's not decreasing. So I will tell you, like because I got a scan within like the first 8 weeks.
Hmm.
And then I did have some decreasing of my cells within like the first 8 weeks. But
Okay.
after those first like 2 months, to be honest with you, nothing really decreased. It only kind of just stayed the same. So in the cancer world, well, the lung cancer world, I can't speak of all
Right.
cancers. When your cancer is stable, that's like a great thing. I know that
Mhm.
sounds crazy,
Yeah.
but because that means it's not growing. So if you would get a scan and your scan says your cells have grown, then they're going to look and say, like, hey, do we need to switch our chemo? So there was no need to necessarily switch my medicine because a whole lot really wasn't going on until about year 3 is when things started getting a little shaky. So in the third year, or was it the fourth year? It might have been closer to the end of the third, beginning of the fourth. I started to actually have progression at this time, which of course means the cancer cells did start to grow. It wasn't a lot, but they started to grow. And at that point, we did switch to it was still another chemo. So it was still chemo, but it was another chemo that we switched to.
Okay. I have a couple questions at this one.
Yeah.
Um, what is the purpose of chemotherapy?
The purpose of chemotherapy is to kill the cancer cells in your body, but because they are not targeted, they just hit everything in your body. Like
Right.
it doesn't matter. So the purpose is to kill the cells. But like
Okay.
I said, in the lung cancer world, if they're stable, it's still considered a win. I know where you're
Interesting.
going with this because
No,
it
yeah,
does
yeah,
sound
of course. I
crazy.
mean, it's just a logical question. Okay, so okay, like for you personally, after okay, like we're talking, okay, you're on chemotherapy. It's 6 months. It's a year. It's 2 years. It's 3 years. It was ever like okay, like what is going like okay, so we're doing chemotherapy, but nothing. It's not going away. So I have to just keep doing chemotherapy, and obviously you probably don't feel well.
Right. Well, remember, I had already been told mine wasn't going away anyway.
I see. Okay.
So it's kind of like with me, stable was still
Okay.
good for
Okay.
me.
So the goal was just to be stable, not to eliminate the cancer. Is that what they told you?
Right. But
Uh-huh.
if it did happen to get smaller, which it did in the beginning, it was a win. And of course,
I
I'm
see.
thinking like I believe in miracles. So at some point they're going to get smaller. No, I mean, not really. They didn't. However, I did want to get experimental though. And I did ask to try a clinical trial. I asked about that, and I did 2 clinical trials. They did not work either.
What is that? What does that consist of, the clinical trial?
So basically, these are different medications that have not been approved by the FDA
Oh shit.
that you're basically a test dummy,
Uh-huh.
like a real test dummy. And especially depending on what phase of the clinical trial, it could be like a phase 1, 2, and so forth. The further along the number, the better the medicine. But you still have to qualify for the clinical trial. So you have to have a certain type of cancer. You have to have not been on certain medications. I mean, they just don't put you on these things. You
Right.
still have to qualify. So
Uh-huh.
that's a whole process within itself.
Right, right. I see. Okay. And what's
Yeah.
the process of the chemotherapy? Is it like injections or what is it? What do you do?
Yeah, mine were infusions. I had to actually go into the office. Some people can do pills,
Mhm.
but I wasn't eligible to do a pill for, I think, like insurance purposes or whatnot. But yeah, I had infusions and I had to go in there and it took about maybe 3 to 4 hours, which is actually not bad because some people have like 8 and 9 hour chemo days.
So what, you just sit there and they just put different things into your body, like what,
Yep,
different
you get
food?
different, like you might get your first chemo might be 1 hour long. And then your second chemo might be a second hour, and then your immunotherapy might be 30 minutes. And then they might have to give you like pre-med so you won't, so to help you not be nauseous or throw up. So that might be 30 minutes. So by the time you add all that up,
Gosh,
you're
it's a
there
lot. It's a lot on
for
the body, huh?
it's a lot. And then you still have to get blood work. So you have to see the doctor. Well, I had to see the doctor prior to getting this done to make sure my blood work was decent enough. Because sometimes if your counts are too low or too off, they won't give you chemo that time.
I
But
see.
luckily, I never had that problem. They weren't off enough where I never got chemo.
I see. So you're just essentially sitting in a chair or
Yep, you're sitting in a chair. I had my computer because I was still working. Like I said, fake it till you make it. Still had my computer. But if I didn't feel like working, I probably would just like play with my phone because I'm not like a big
yeah.
reader, to be honest with you. So just do
Uh-huh.
something to bypass the time.
And what, you just have a needle in the arm? Is that what it is?
Well, so I actually have a port. I have
Okay.
a port under my skin, which I got surgically done
Mhm.
or put in rather. And the port actually just allows you to be able to go in and
Right.
put the medicine in. So you won't have to keep injecting, poking me around. Some people prefer to be poked. I don't. So
Wow.
yeah.
Okay. So okay, we're at the chemotherapy. It's at the chemotherapy stage. It's a lot. I mean, it's a lot. It's just
Yeah.
insane what you've had to go through with this. It's mind blowing. Okay, and the crazy part about all this is that you had to go through 4 years of chemotherapy for them to tell you, oh yeah, we're just gonna do a lung transplant and take the lungs out anyways, right?
Yeah, so the thing about that, a lot of people ask me about that. So they basically let the lung transplant be like a last resort. They
Okay.
want to at least, I guess, like try things
Yeah.
first before they mention it, before they do it. They actually had mentioned a double lung transplant to me um a year before I got it. But we didn't want to do it yet because,
Mhm.
and you can tell me when you want to get to this, because I had to move in order to get this done
Uh-huh.
for a
Uh-huh.
year. So that's a whole nother
Yeah,
story.
yeah, yeah. I've heard that quite a bit, quite often. Let's talk a little bit about that process. Like, okay, so we're going through the chemotherapy. Where you said 4 years, what you did it
hmm
for? Okay, so
Four and
after
a half, pretty much.
four and a
Yeah.
half years, wow. And then what happened after this? Like, when did the discussion start being like, okay, now maybe we got to do a double lung transplant?
So the discussion started last summer, actually, like last June. Um, I was still starting to progress, and my only other option was to try another chemo, which would have put me on like my I think fourth chemo or something. I can't even remember at this point. Or to do more clinical trials. And I just really wasn't feeling doing that. So I entertained the whole lung transplant situation. And that actually, I had to have a virtual consult with the thoracic surgeons. So basically, what they did was they looked at all my files, just what I had available. And they were like, hey, I'm going to be honest with you. They didn't say it like this, but I'm going to say it like this. They said, your lungs are trash and basically um you're going to die if you don't get this done because if you get chemotherapy again or a clinical trial again, it's only it's basically just passing time because at some point it's not going to work, basically is what they said. So at that point, I started the process for the bilateral lung transplant, which consisted of I had to move, well, the testing was in Chicago because this facility, so everybody does not do double lung transplants on cancer patients.
Right.
So that's a whole nother situation.
Yeah, yeah.
So I had to go through a medical evaluation, like a psych evaluation, an evaluation to make sure I had somewhere to live when I got here. I had somebody to take care of me. So the whole process was like July, August, September, October, November. The whole process was like four or 5 months to go through evaluation. So I had to make sure I passed the evaluations in order for them just to give me a yes.
Okay. Okay, let's talk a little bit about that process. Okay, so just to be clear, I want to backtrack just a little bit. We went through the
Mhm.
chemotherapy. Now, as far as your like physical state, were you not able to breathe? Was your lung function very low? Did you feel like you
Good
couldn't?
question.
Yeah.
So my right lung was pretty much normal. It was functioning at like 98%. My left lung was functioning at about 6.
Wow.
So basically my right lung was doing all the work. I did not have oxygen or require oxygen. However, I did get tired extremely quick.
Right.
So like, when I was basically flying back and forth doing this medical evaluation and I had to be pushed around in a wheelchair in the airport because I just couldn't walk. I just couldn't do regular walks in the airport. It had gotten to that point. It was never at that point, but over the years, it started to get that point. So yeah, no oxygen, but my lungs were not good. And then I had this cough. So
Mm.
this cough was draining me so bad
Oh, it's
because
draining. Yeah.
I had a cough tracker on my phone. It's an app in case people don't know about it. And it tracks how many times you cough. So
Wow.
I was coughing between 100 and 300 times per hour. And I would cough so much, occasionally I would crack my rib. And so this happened like it was like a regular thing. I would cough and I would hear a crack. It would
My
hurt for a
gosh.
while, and then I would just keep moving. I mean, I was just kind of used to these. It sounds crazy, but once the stuff just starts happening to you,
I
you get
understand.
used to it and you just keep it moving,
Becomes your new
basically.
normal. Becomes your new
Right.
normal.
Right. Unfortunately, it becomes your new
Yeah.
normal. But yeah, that's what the situation kind of was like. I still kind of had an appetite. I had started losing weight though, just because sometimes I just didn't feel good. Even from like a mental standpoint, I was just like over it.
I'm
So
sure.
yeah, things just start kind of slowly deteriorating.
Okay, so one lung was 90. Did both of the lungs have the same amount of cancer?
hmm Well, no, one had more, but yeah, they both were
The left
heavy.
one? The one the 5% one?
The left one. Yeah, the left one had more.
Okay. And the other one was 98%. So that's almost like a fully functioning lung, right?
Yep, but it was still full
Oh,
of cancer.
interesting. I wonder why
Mm.
one of them deteriorated so much and the other one didn't, but they both had cancer.
I don't know. That's a good question. I
Yeah.
never even actually asked that because I didn't even find this out until almost the end. Like
Mm.
they claimed that they had told me, okay, I'm not gonna lie. Because of chemo, I did develop like memory fog, brain
Of course.
fatigue.
Yeah. Yeah.
So, they might have told me that in the beginning. I
Right.
don't know,
Yeah. Yeah.
but I remember them saying this in
Right.
the end versus the beginning.
There's a million things going on. Okay,
Yeah.
let's talk a little bit about the lung transplant process of how that went and what the conversation was.
Yeah. So, like I said, first conversation was with the thoracic surgeon. He says, from what I have on paper, it looks like you're a fit, but we have to go through all of these tests. So I probably had to go through about maybe like 20 tests or something. I can't even remember, but it required me to actually go to the hospital, get these tests done. And like I said, I had to do like a mental evaluation with a social worker. So I had to move from Atlanta to Chicago. And I actually had to stay. I'm still up here because I just got the transplant in November. But as a part of the program, you had to stay up here for 1 year. And reason being is because they want to monitor you. They want you to be close to the hospital in case anything happens. You have weekly appointments, blood draws, x-rays, CT scan. You still have to get all of that stuff done while you're in this program. But anyway, so I was very nervous about passing the medical evaluation. And the reason why is because when they did a biopsy, they wanted to make sure that the lymph nodes that were with it. Okay, so first of all, back up a second. Sorry so much. So the main criteria for this double lung transplant is that the cancer has to only be confined in the lungs. Anything that's outside of here, you don't qualify. So, example, if you have brain mets, which means it spread to your brain, you do not qualify for this, according to what they told me. So, luckily, everything was confined to my lungs for the 4.5 years. Nothing ever went outside, which they told me is extremely rare. Like that almost never happens. So I was actually lucky that that never happened. But anyway, so what I was saying as far as a biopsy, they had to do a biopsy to make sure that you had no other lymph nodes that were cancerous. So I was kind of nervous about that just because of how cancer is. I was like, oh my goodness, what if something is cancerous and I just didn't know it? So that was like one of the biggest tests that I had to mentally and physically pass. So once I passed it, basically the board had to meet. They had to have a meeting, look at all of my tests. Like I said, that being one of the main tests. And once they actually had this meeting, which was about 3.5 months after my initial consult, that's when they said, we do approve you for this double lung transplant. And we will, of course, perform the surgery for you as long as you agree to move to Chicago and so forth. So I said, hey, I agree to move to Chicago. Basically, they said you will be listed on the list for the lungs once you actually get to Chicago. So I had to wait until I got here before I actually got listed for the transplant. And luckily, it only took me 5 or 6 days to get a call for the transplant.
And what was the meeting for? What did they have the meeting for?
So the meeting was composed of, consisted of rather, oncologists, thoracic surgeons, pulmonologists, different medical doctors to look at each one of the tests to make sure that I actually qualify in those different areas. So that's why they came together to meet just to make sure everybody was on the same agreement, same decision.
I see. And they decided that you
Yeah.
qualified for it. And then what happened?
They told me that how soon can you be in Chicago? How soon can you get up here? Because as soon as you get here, we're gonna list you. And so I said, give me like a week or so. I need to go home and pack real quick. Of course, I'm anxious to get up here, but at the same time, it's like they're ready for me to come like now. And I was like, well, you gotta give me just a second because I gotta pack my clothes. But I packed my clothes, came up here, and like I said, waited for maybe like 5 days. They called me. And so I thought it was gonna be, and I think somebody that was on your show talked about dry runs or something like that. I thought it was gonna be a dry run because they told me that those do happen. So they called me on a Thursday night and said, hey, we might have some lungs for you. Here's the situation. We have another person who is waiting as well, but we actually think that the lungs might be a better fit size-wise for you. So we want you to come in the morning, which is on a Friday morning. We're going to prep you and all of that, but it still might be a possibility that you might go back home if these lungs actually fit this other person better than you. So I'm like, oh goodness, we're about to have a dry run. So I had already mentally prepared myself that I was going back home. So I was in the hospital probably like 6 or 7 hours just waiting after they did all these tests. And then they came in and they called me first to tell me that the lungs were going to me. And then they came in there and they told me, and they're like, we're ready to go. I was like, what do you mean you're ready to go? They were like, yo, this is about to happen. And so I'm like, wait a minute, hold on, my heart's beating out of control. And I said, well, I asked you, like, how soon after you tell me they're mine are we going to do this? And you guys told me like 2 hours. I'm thinking at least I got 2 hours. Well, I didn't have 2 hours. As soon as they told me this, they basically were ready to roll me into the OR. So they rolled me upstairs, and the first thing I asked for was some medicine to calm me down because I'm like freaking out. So as soon as they give
Did
me
you
the
know the process of the transplant, what they actually have to do? They
well,
explain that?
yeah, they kind of explained it, but I actually knew somebody else who went through the
Okay.
same procedure like 5 months before I did.
Oh,
So
that's lucky.
thankfully, this person was able to guide me and kind of coach me. They didn't tell me everything,
Right.
but they told me a good bit. So it's like I was surprised, but not really surprised.
That's lucky.
I just didn't know things were gonna move as fast as they did. But I mean, as soon as they got me upstairs, they gave me some medicine to relax me. They went over, some basic things, and then I was off to the operating room. And next thing I know, I'm waking up like a day and a half later. Didn't know what was going on because the surgery took like 8 or 9 hours. And oh my gosh, when I woke up, it would just felt life changing, and I was in so much pain because I found out that my surgery was complicated. And like they had a hard time getting like the lungs out, I guess because they were so diseased. They had to call in another surgeon to assist them with surgery. So my surgery was a little bit more complicated, I think, than the normal double lung transplant cancer patient.
And what did the surgery consist of?
All I know, and from what I read, is basically, of course, then removing my old lungs, placing in my new lungs. But throughout the process, I lost a good amount of blood, so I had to have some blood transfusions. They had to end up giving me extra incisions that they didn't necessarily plan for, just because of how my body reacted to this. Like I said, they had to call in the extra surgeon just because my lungs were, we already knew they were diseased, but they were, I forgot what word they used. They were like more diseased or more dead than what they thought. So it was just extremely hard to get the lungs out, basically. So it was just complicated from what I know and
And they
remember.
did they cut your chest open?
Oh yeah, so it's like a clamshell. They cut it open like clamshell style. So like a clam, it's yeah.
Yeah, yeah. What was the pain? You said you were in an extrusion, a lot of pain at the end. What was the first thing you felt when you woke up out of that 9 hours or day and a half or whatever it was?
Well, I was oh no, I'm sorry. When I woke up, I had like the tube or whatever in my mouth, and I was trying to talk and realized I couldn't talk. So I was like, get this out of me is what I was saying. And like I was freaking out. So I kept telling them to like give me something to write with. And I wrote like take this out. I was freaking out and my mom got scared. And she was like, "Oh, I could hear her saying she's freaking out. Can y'all please take this out?" And they were like, "Well, not yet. We got to make sure she's breathing on her own." And then I think my mom later on was like, "Okay, she's breathing on her own. Let's take it out." So they ended up taking it out sooner, I think, than what they were supposed to because I was freaking out so bad. But I was able to breathe on my own once they took, like I was okay once they took it out. But that was the first thing. I had this thing and I didn't like it.
Yeah, well, of course. Did you notice a difference right away with the lungs?
I did actually, because within the first maybe like 15 minutes, I was waiting on myself to cough. And once I didn't cough within the first 15 minutes, I was like, oh, I got some lungs. Because
Isn't
that's
that
all I did.
isn't
Yeah,
that
I
an
coughed all
incredible
the
feeling?
time.
That's such an
Yeah,
incredible
so
feeling.
I automatically knew that something was different because I didn't cough.
Yeah, wow, it's just it's the little simple things like, oh, I just didn't cough like now
Right, it's so simple.
and you can breathe normally.
Yeah, I could tell a difference in breathing. I never really was the person that had like a super hard time breathing, but I could
Mhm.
still tell my breathing was just like more clear.
Yeah,
It
yeah,
felt more natural.
I see. And how long ago was this? Did you have this transplant? This is recently, right?
November 15th.
Oh, okay. So yeah, a few months.
Yeah.
And how are you now?
I'm doing pretty good. I still have complications. Like I have like my chest feels heavy, like there are bricks sitting on it. They said that that's a part of the recovery. It's normal. I don't have any shortness of breath. I don't cough or anything like that. There is still pain, like I said, that's associated with my chest,
Uh-huh.
but it's slowly getting better. I mean, like every day I can tell a difference. I can actually sleep at night. Like the first month, I couldn't sleep because I could only like lay on my like back, but now I can actually lay on my stomach. I can lay in different directions. So it's getting better. I do rehab. Well, I was doing it 3 times a week, but now I do it 2 times a week. And of course, after rehab, I might hurt more because I'm moving parts of my body that I haven't moved in forever. I do take, oh, this is one thing I wanted to share. I do take a lot of pills. I'm sure you talk to people that have had transplants, but I take about like 32, 33 pills a day as a result of this transplant. Now, some of those will calm down, but a lot of these I do have to take for life, specifically the organ transplant medication, because you got to make sure that your body does not reject the organ, which are the lungs. So I do have to take a lot of pills a day. And I'm getting used to it. At first, I'm like, this sucks, but it saved my life. So I'd rather take a bunch of pills a day than not be here.
So 33 different medications?
33 different pills. So it might be like one, it might be one medication, but it's like six of the same pill.
I see. And
Yeah.
what do they consist of? You obviously you have to have take rejection drugs so that the
Yeah.
transplant doesn't. But
So they
what else do they have you on?
I have steroids. I have to take several of those. I have to take like infection medications because they said that you're at a higher risk to get infections. Let's see, I'm actually looking at some of them now. Yeah, it's like three different infection medications just on your own that I have to take basically. So it's just a lot of different pills. I'm taking opioids, of course, because I'm in pain. I have to take high blood pressure medication. I had hypertension before, so that's really nothing new. They just put me on different medications. And then of course I have like my multivitamins and all of that. But without the multivitamins and like the vitamin D and all that, it's probably about maybe 26, 27 pills, but the multivitamins and all that make up for like the 30 something.
Wow. And do you take any other natural stuff, like any homeopathic stuff? And obviously you take a multivitamin. Do you take any other vitamins or supplements?
Yeah, I just take like vitamin D, B6. That's pretty much it. I actually was doing see, here's the brain fog again. Before I left, I was doing the what do you call it when they put the needles in you? I can't think.
Acupuncture?
Um, yes, I was doing acupuncture before I left, and acupuncture was helping me a lot. And I actually want to start back taking acupuncture. I'm going to see, get permission from them to see if I can start that back up again.
I see. I see. Can I
Hmm.
recommend a couple things for you?
Yeah, sure, of course.
Just because you're taking a lot of stuff, your
Mhm.
liver is important because we have to cleanse the liver, especially when we're taking different medications. Have you ever heard of milk thistle before?
I think I have, but I don't know what it is.
Yeah, so it cleanses the liver because you're on a lot of
Hmm.
medications. It attacks and it can destroy the liver, especially if you're taking opiates, rejection drugs, and things like that. I would recommend if you could go to like a store, you can even get it on Amazon. I can
Hmm.
send you the one I take if you want. Just get milk thistle and just take it
Yeah.
daily. It cleanses your liver
Okay.
because it's hard on the liver to take all that stuff.
Yeah, I would
The
definitely
liver,
like a recommendation.
yeah, I have a, but I've taken vitamin. I'm a natural guy, so I take a lot of vitamins and supplements every day, and it's been a big
Okay.
reason why I've been able to battle my illness. But I can
Okay.
recommend you some different things. I can send you a list of the stuff I take, and then you can research it, and then whatever one you want to do.
Yeah,
Help you get
no.
off of some of those medications, actually.
Yeah, send that to me. I'm always looking for anything. I'm like I said, I'll take feedback or whatever. I'm new to this part also. So,
It's saddening to me that they don't recommend any of that. That's what saddens me, you know. But
nah,
that's the world we live
not
in.
really.
You know what I mean?
Of course. That is
Yeah.
definitely the world we live in, a world of medicine.
Yeah, exactly. Natalie, I want to end with just one thing. A little bit more on a serious note. Obviously, what you're talking about is very tragic and very, I'm sure, very dark for you. Can you just tell the audience and myself, like, how you dealt with those really dark days? Because you've been told that you're pretty much going to die for years. I mean, how did you
Yeah.
deal with that? Like, what are some of the things that you use, or maybe some of the practices that you have for yourself, just to keep yourself mentally sane and keep yourself going day by day? Because it's easy just to give up and say, I'm done with all this. But
Oh yeah.
can you just tell us a little bit about on a deeper level, kind of what you do to get through these dark days?
So my number one biggest thing is my support system. Without my support system, I would not be where I am today. My husband is my biggest cheerleader. There's so many days, months, weeks, years where I was ready to give up, ready to throw in the towel. And the things that he said to me, I mean, I'm not just talking about like, I love you, but the things that he said to me to keep me encouraged, to keep me going um, has brought me thus far. I have a great family as far as a support system. I have a great friend support system. I mean, like I have friends that live in Atlanta and further that fly up here to Chicago to be with me. And that's amazing because everybody has their own lives. So like I said, the support system I think has helped me. Prior to my diagnosis, I was not going to therapy. I now have been in therapy pretty much since like 2021 because when I first got diagnosed, I'm like, I can handle this, but I couldn't.
Yeah.
So I definitely see a therapist now. I tried to do a lot of things, I guess, to mentally stimulate me. So, like for example, I lost all my hair during chemo, and it's just now starting to grow back because I just got off chemo in November. And like yesterday, I went to go, like you can't really see it because it's blurred, but I went to go get my hair colored, and that just made me feel so good. So I try to do things that like make me feel good, versus everybody else. I
Mm,
also put myself first,
mhm.
because if I'm not putting myself first, then obviously I'm going to feel even more terrible than anything. And then I wanted to live. Like I wasn't ready to die. To be transparent throughout this whole process, I've never been the one, I've never been suicidal. I've never been on antidepressants or anything like that. I actually wanted to live because I wasn't ready to like leave my husband or leave my family or
Of
my
course.
friends. So that was another thing that motivated me to try to hopefully continue to have stable scans and figure out a way to make this work. Pretty much is kind of how I know the traditional answer might be like, oh yeah, I might read thousands of books. I'm not a reader. I'm not gonna lie. I hate reading. I'm trying to, but I can't get off the first page after 20 minutes. So that's not really my thing. But yeah, those are pretty much like the things that I do. I love to travel. So hopefully I can pick up traveling again, once I get in a better situation.
Yeah, well said. Yeah, I'm glad that you have that support system. It's very important. Um,
Yeah.
Before we go, if there's somebody watching this, maybe that is in a similar situation as you, or maybe they just can relate to you in some way, like through the cancer, through the transplant, whatever it may be, can you just leave the audience with one thing to just maybe stay positive? What would you leave us with to help people just maybe that are struggling? Doesn't have to be with cancer, but maybe just in their daily lives. What would you leave them with?
I probably would say, which I know this is probably like cheesy, but I would say I'm not gonna say don't give up. I'm gonna say try not to give up
Mm,
because everything is always easier said than done. I would say just try not to give up. Try to push as best as you can, but we all get tired no matter what the disease is, no matter what the situation is. I mean, aside from this, I'm actually, to be transparent with you, I'm actually going through something right now, family wise. I have family members that are currently in hospice. So
oh,
I'm dealing with that in addition to dealing with trying to recover. And I am just like, hey, Natalie, try to keep pushing. Everything I say, I put try in front of
yeah,
it.
yeah.
So try not to give up
Yeah, it's a
is what
day
I'm gonna
by day
say.
process. It's a day by day
Yeah.
process. Is there
Yeah.
anything you want to ask me before we go, or anything you want to add before we go?
Yeah, well, one thing, thank you for allowing me to share my story. I think this is awesome. And I was obviously looking at your page. Just want to kind of get a little idea about, kind of what you've been going through. I'm just curious.
Yeah, absolutely. Well, I have cystic fibrosis. I was diagnosed at birth. I was given 19 years to live with my diagnosis. I suffered for about 26 years with my illness. I coughed. I can relate to your coughing story because I coughed for 26 years.
Oh
And I
gosh.
suffocated for 26 years. I couldn't breathe. I used to do 4 hours of breathing treatments every day, 2 hours in the morning, 2 hours at night. Lived my whole childhood pretty much as a sick, dying child, even into my adulthood, because my
Oh
illness is
gosh.
progressive. So as you get older, it
Mm,
gets worse and worse. Um,
really?
I also kept my illness a secret for about 20 plus years. So nobody really knew around me. I just kept it a secret. But then I got really sick when I was between the ages of I would say 24 and 26. I got really sick. I was pretty much at the end of the road with cystic fibrosis. I was talking lung transplants and things like this. I was about in
Oh
my
wow.
I was about 30% of my lung function. um,
Mm,
and then a medication came out in my community that saved my life, so I went from 30% lung function and now I have one of the highest lung functions in the community. I'm like about 116%.
mm,
But I dedicate my, it's through fitness, it's through the mindset, it's through being able to do it. So the premise of this show is I started doing some interviews and being open about my illness about 5, 6 years ago. I came out to this and announced it and just wanted to start advocating and tell my story because there were so many things that I was dealing with that I thought maybe somebody else could benefit from what I was dealing with. So I just started sharing my story. And then so many opportunities came from the story. I was on different shows, different podcasts, different movies on the radio. And then I was like, okay, maybe people are relating to me and this is something that this is a purpose of mine in my life, what I've been through, the hell that I've been through. And so the premise of this show was to just have people on and share their stories because people didn't give me an opportunity a lot of times. I didn't have a role model or somebody to look up to be like, oh, wow, I'm going through that too. This guy knows what he's, or this girl knows what they're doing. I'm looking up to this person. This person has been through the same thing. I can relate to them. So wanted to start my own show to just be able to let people vent and share their stories, and maybe there's somebody else they can connect with. They can make friends through this. They don't have to be famous and have millions of followers. I just want to let people share their lives and share their interesting stories. And I don't just do chronic illness. I do everything. I have experts on of different stuff. I have different people. I have actors on. I have whatever it is. But yeah, so that's kind of a little overview of my story. But
Gotcha.
that's kind of
Wow.
the premise of why I started the show too.
Wow. That's a lot also. Jeez.
Yeah,
I
yeah.
didn't know any, I don't know much about that. But I'm definitely gonna go look it up now.
Yeah, cystic fibrosis, it's a
Yeah.
genetic illness. It floods all the main organs with thick, sticky mucus. So for me, it affected my lungs really bad, but it also affects my pancreas, my liver. I can't eat food without taking pancreatic enzymes. I have lower bone density, supposedly. I don't. I've been in the gym for 12 years consistently, even when I was very, very sick. So my bones are quite strong. A lot of the stuff that a typical CFer has, I look a little bit different, and a little bit. I look a little bit different than a lot of the people that have my illness as well. So
I see. Okay.
it could be just a blessing, but it also could just be, my practices of what I've done for almost 15 years of my life. Fitness has definitely saved my life in so many ways. But yeah, so that's
Gotcha.
pretty much what the illness is. So it's a genetic illness. Both of my parents had to meet. Conveniently, they had me. I got the illness. I'm the only one in my family who's ever had it. Um,
Mm.
yeah, so I had to deal
Wow.
with that. So I dealt with, you know, I've had multiple near-death experiences with it. I suffocated in my sleep for 26 years. Yeah. So,
Wow.
but now I'm here. So I'm 31. I was only
Good.
supposed to live to 19. I'm 31 now, and I'm as healthy as I've ever been.
Well, that's great to hear. I'm glad you're still here and you're healthy.
Yeah.
That's
Thank
awesome.
you. I appreciate it.
Yeah.
Natalie, where can people find you online if they want to reach out and you know, give you an encouraging message or maybe become a new friend of yours? How can they reach out to you? How can they find you?
Yeah, I am mostly it's every time somebody asks me this, I have to look. I don't know why I can't remember
Your
my name,
Instagram?
but yeah, my Instagram. I'm mostly on Instagram. It's Natalie underscore B10 on Instagram is mainly where you can find me. That's pretty much where I do all my posts, my stories, and a lot of my advocacy.
Okay, great. Well, we'll
Yeah.
definitely have people try to follow you and reach out to you. But I appreciate you coming on today.
Yeah, me
I enjoyed the
too.
conversed well
Me
told.
too.
You articulate your story very well, so that's appreciated. But
Thank you.
yeah, guys, if you want to follow Natalie, shoot her a DM, give her a follow on Instagram. Um,
Yeah.
Thank you guys for joining us this week. Next week we'll have a new episode of James's Corner. Make sure you guys subscribe to the channel on YouTube and continue to share our stuff around the internet. Thank you guys for joining us. We'll see you all next week.
Thank you. Have a good one.